Hello, testing. Yeah, sorry for a little delay as there's another important meeting going on with the ministers. So we are just waiting for a couple of minutes more. So thank you for your patience. And also we are trying to bring more colleagues who are finishing their lunch quickly. So just if you don't mind for 2-3 minutes, thank you. Thank you. Thank you for waiting, and sorry for a little late. So many important meetings are back to back. So now, without further waiting, and a big thanks to everyone here, including our excellencies. So good afternoon and welcome to the session that's Together for Clean Air, Standing Multilateral Action to Address Air Pollution in Asia Pacific. Now, I would like to recognize and appreciate the Ministry of Environment of the Republic of Korea for sponsoring this session jointly organized by UNEP and the Ministry of Environment of Government of Sri Lanka. And also big thanks to Republic of Korea for supporting the Clean Air Day commemoration and other projects. So my name is Mushtaq Memon, and I'm a regional coordinator at the UNEP Asia Pacific office for a sub-program called the Chemicals and Pollution Action. And as air pollution in the region continues to be a critical, it affects us all. However, the most vulnerable people, women, children, the elderly, and the poor with limited access to the healthcare services are the ones who suffer the most. But there's a good news as well that there are cost-effective solutions. There's a technology transfer. There's a North-South, South-South cooperation in place. In Asia-Pacific, the report Air Pollution in Asia-Pacific, that's Science-Based Solutions by UNEP, Asia-Pacific Clean Air Partnership, Climate and Clean Air Coalition. They identified 25 policy and technological solutions to address the key sectors in Asia-Pacific for air pollution. Engagement of the industry and private sector will be critical for innovative and transformative action for clean air. So without further ado, to start this session, we are really honored to welcome His Excellency Lim Sang-jun, Vice Minister of Ministry of Environment, Republic of Korea, and we would like to request for his opening remarks. Sir, floor is yours.
Thank you, Dr. Memon. Excellencies, distinguished guests, good afternoon. I'm sorry to keep you waiting for so long. There is another meeting hosted by Sri Lankan government environment minister, so I have to be there for a second. I'm so grateful to have all of you for taking time out of your busy schedule to attend our event Together for Clean Air. I must also thank UNEP Regional Office for organizing this meaningful hour. Today we gathered here in this room to discuss much challenging issue, air pollution, by sharing our practices and knowledge in Asian Pacific region. It is contradictory that air we breathe every day is lessening our life day by day. This morning, I made my speech in AP Forum about pollution, showing some numbers, and let me re-emphasize it. WEF already pointed out in 2017, air pollution caused life expectancy by average 1.8 years per person, making it world's top killer, while smoking costs 1.6 years. In part of some country, could live 11 years less due to high level of air pollution. And 92% of air pollution, world population lives in the place where air pollution exceeds the safe limits. And 94% of deaths from air pollution are in low and middle income countries. So according to the UNEP report, 4 million people died prematurely by being exposed to high level of air pollution every year in Asia. Same as in many disasters, the most vulnerable of our community are worst affected by air pollution as well. Many countries are making efforts to reduce it, but individual countries' effort alone is not enough. The air is not something we can control in the national boundary. The only solution is cooperating among countries. Lots of countries in Asian Pacific region are struggling with air pollution caused by rapid industrialization. It is definitely a dilemma in economic growth and environment protection. Korea has a similar record of this such dilemma, and we would like to share with many other countries our experience. Today's event will be a good platform to share our experiences. Sorry. I hope today's discussion brings better and insight ideas for the reason to have cleaner, healthier, and more sustainable air. Thank you.
Thank you, His Excellency Lim Sang-yun, Vice Minister, Ministry of Environment, Republic of Korea. And despite of, as you see, so many things are happening, we are also lucky to have our regional director and regional representative for Asia Pacific for UNEP, Ms. Daijun Sharing. May I invite you for the opening remarks?
His Excellency, Mr. Lim Sang-jun, Vice Minister, Ministry of Environment, Republic of Korea, Excellencies, esteemed delegates, ladies and gentlemen. It really is a pleasure for me to be here at this important side event, and I see many familiar faces in the audience. I think we have a lot of data on the negative impacts of air pollution in our region, Asia Pacific. We have 100 most polluted cities in the world. So we start to really the link between human health and the environment is very strong. There's a regional ministerial forum, which WHO and UNEP work with the Environment and Health Forum. And there's also been more and more momentum in different countries in our region. And we did a review of legislation across the region. Some of them do have, there's clean air, there's some sort of law. Sometimes it's enshrined in the Constitution. There's monitoring happening. There's different kinds of data. But what we found is that it's too scattered. And as Honorable Vice Minister said, it's a transboundary nature. In recent years, we've had, of course, UNEP, UN Environment Assembly resolutions, and then we've had, of course, ESCAP resolutions. And I think the most positive aspect has been this regional action program on air pollution under the ESCAP with the ESCAP member states. So it is an opportunity for us to come together, and we're talking about strengthening monitoring, strengthening sharing of data. The Asset Deposition Monitoring Network, it's been now over 20 years looking at asset deposition, but they've expanded their scope to air pollution. So I think this forum is going to be really important. I mean, over the last few days, we've looked at how are we sort of responding to the UNEA resolutions? And also we're looking at what comes up for the 6th UNEA session and for the upcoming ESCAP commission sessions. There's an opportunity for us to come together. We're looking at, but I think we have to, collaborative. We start to look at the different networks. We're looking at sharing information, but really look forward to the discussions that are held here. The International Day on Clean Air for Blue Skies, I mean, there was a tremendous momentum. We also had a Clean Air Week in Thailand. There was a high-level forum in Mongolia. So there is some momentum, but I really look forward to how we can work together much better and really look at the whole taking air pollution, the multilateral action to address pollution. So with this, thank you, Mushtaq.
Thank you, Ms. Techen Sharing, Regional Director and Regional Representative for Asia Pacific UNEP. Now, as quickly, I would like to share some of the good practices, especially from Republic of Korea, because there's a lot of coming through that what countries can do. And as we have seen the Republic of Korea over the last 50 years, how they transform with economic growth, but also the technological and political leadership. So this is very important for the knowledge sharing, for the technology sharing. So I would like to request for a quick 1 or 2 minute video to show our experiences from Incheon, Gyeonggi, and Seoul.
Air pollution is one of the world's largest environmental risk factors for human health. 99% of the world's population is exposed to unhealthy levels of microscopic airborne particles, known as PM2.5. Sustained exposure can lead to a myriad health conditions, resulting in 4 million early deaths a year in Asia-Pacific alone. Not to mention non-fatal conditions, such as asthma and reduced fertility rates, which have economic as well as social impacts. These impacts are magnified in Sydney, where more than half of the world's population lives. Seoul, Incheon, and Gyeonggi, known collectively as FIG, are 3 administrative areas in the Republic of Korea. While they are governed separately, FIG makes up an area of 46 million people, the 5th largest metropolitan region in the world. From the 1960s, the Republic of Korea prioritized economic development, which led to widespread industrialization and urbanization. But as the country's GDP rose, so did a number of environmental challenges, including air pollution. By the early 2000s, the Korean government started an intensified drive to improve air quality across the country. The result has been a substantial decrease in air pollution levels throughout FIG, providing a practical example of how the implementation of national and sub-national policies and measures can help achieve real improvements in air quality. Key to FIG's success has been a robust legal, governance and policy framework developed at the national level through cooperation between the central government and local government, ensuring effective implementation of policies by different provinces. This national framework is being supported with substantial financial backing, totaling $100 million over 15 years, with over half of that total focusing on reducing emissions from the transport sector.
아무리 좋은 아이디어라도 실행할 재원이 없다면 그가 아이디어에 불과합니다. 그렇기 때문에 서울시는 대기형 감축 정책을 충실히 이행하기 위해 중앙정부 재정투입을 이루어가는 한편 서울시 자체 재정을 투입하는 등 많은 노력을 기울여왔습니다. 저희는 이것이 서울시뿐만 아니라 국가 전체의 미래를 위한 투자라고 생각합니다. 서울시민의 건강과 삶의 질을 크게 향상시킬 수 있도록 지금까지의 노력을 앞으로도 지속해 나갈 것입니다.
The effect of this investment in policy implementation can be clearly assessed by a extensive body of publicly available data collected through a network of air quality monitoring sites from across FIG. The data is used to assess long-term trends between pollution concentration and health outcomes, as well as informing future policies and measures.
우리 2010년 지난 15년 동안 수집한 데이터를 살펴보면 우리가 그동안 시행한 정책이 실질적인 것으로 있었다는 것을 알 수 있습니다. 누구에게나 공개되어 있고 활발한 방대한 데이터가 있었기 때문에 우리 인천시에서는 수시로 정책 접근 방식을 검토하고 개선 방안을 마련하여 데이터를 개선해 올 수 있었습니다. 앞으로도 이러한 노력은 계속될 것입니다.
Pollution reduction in SIG is now at a crossroads. Policy implementation has led to the substantial improvements seen over the past decades. But there are still major sources of pollution to address and further improvements to be achieved. One of the key findings from the last 15 years of data is that greenhouse gas emissions have not reduced at the same rate as particle matter emissions. The good news is that the Republic of Korea and the SIG climate change targets include a range of mitigation measures that could also contribute to clean air action. The electrification of vehicle fleets, stringent energy efficiency measures, and switching to cleaner fuels in industry could reduce carbon emissions while also improving air quality.
우리는 경기도의 대기질 개선이 지속 가능한 사회와 환경 개선이라는 큰 과제의 일부라는 것을 알고 있습니다. 더불어 우리는 대기 오염 물질 배출량을 저감하여 미래 세대들이 맑은 공기에서 숨쉴 수 있도록 대기질을 개선해야 할 뿐만 아니라 온실가스 저감을 통해 지구온난화 문제를 함께 해결해야 할 책임을 가지고 있습니다.
The story of SIG shows us that clean air in a densely populated Asian megacity is possible. But the efforts are reliant on a coordinated approach across both the public and private sector, with continuing efforts to develop data-driven policies and measures, backed by sufficient investment, further reductions in both air pollution and greenhouse gas emissions can be achieved. Showing the way forward for cities across Asia that want to create blue skies for everyone.
Thank you again for Republic of Korea and Incheon, Gyeonggi, and Seoul governments for the support. And as we see that everything is possible if there's a political will and the technological development. And as UNEP is convening the knowledge transfer or sharing the experiences, bringing the resolutions to work, which are from the member states and so on. So at that note, now let's move to the OECD, as they have a recent publication on air quality in Asia and the Pacific. So let me invite Dr. Elisa Lenzi, Senior Economist of the Environment and Economy Integration Division of OECD, for her presentation, please. Thank you.
Good morning, everyone. I hope you can hear me well. I'm delighted to be here today to share some of our findings from our recent work.
Elisa, are you available? Anyone?
You can't hear me?
Yeah.
Can you hear me?
Yeah, we can hear you. And are we trying to? Okay, here you are. Please, over to you. Thank you.
Okay, great. Thank you. Right, sorry, I'll start again then. Well, I'm really delighted to be here today to share some of our work on air pollution, specifically focused on Asia. As we've just seen with the example of Korea, countries are already working a lot on air pollution in Asia and actually all over the world. But there remains a question on how can we go farther? How can we meet the actually recently revised WHO guidelines, especially in cities? And what we've been trying to do at the OECD is trying to increase the motivation for scaling up policy action, well, with focusing farther, not just on the environmental and health benefits from air pollution policies, but with a further focus on the economic consequences and benefits from air quality policies. We've done so with a specific focus on Japan, Korea, and China, trying also to look at the additional benefits from regional cooperation to reduce air pollution. Specifically, we've developed policy scenarios to 2050. The policy scenarios focus on how the implementation of policies that incentivize the deployment of the best available technologies will lead to better air quality. We also focus on different levels of regional cooperation. So single countries taking policies, scaling up policies, regional cooperation, and then a global scenario, which then gives us an idea of what happens when there's further regional cooperation. The way we do so is by providing a link between economic activities by sector and then air pollution in terms of emissions and then concentrations of key pollutants, namely fine particulate matter and ground level ozone, and then linking those first to the biophysical impacts, mostly on human health, but also on the agricultural sector, and most importantly, how that feeds back into the economy. Specifically, we then basically balance out costs and benefits. On the one hand, we'll have economic benefits that will spur from higher labor productivity, higher agricultural productivity, and lower health expenditures. Basically, we'll spend less on health and more on more desired products. And then on the other hand, we have the economic effects of the investments in best available technologies. So all of this is what we refer to as macroeconomic effects, which we study in our computable general equilibrium model, EMV linkages. On the other hand, there are also effects that can't easily enter a model. So those are from reduced mortality and reduced illness, and we refer to those as the welfare improvements from better air quality. All in all, these two aspects will give us a comprehensive effect of the economic consequences of air pollution policies. So I'll just show some results. And what we see in these slides is that we have benefits on the one hand, that's the gray bars, and costs on the other hand, that's the blue bars. And what we see is that the benefits and the costs overall will balance each other out, and that the benefits relatively increase more the more we have regional cooperation. So there are indeed economic benefits from regional cooperation. If we look a bit more specifically at the benefits, we see that most benefits will come from increased labor productivity. So to get back just a quick reference to the previous video presentation, in cities where most people live, being exposed to air pollution also leads to being less effective at work, and therefore having also economic consequences for firms, for instance. The better health would lead to also people feeling better, but also more productivity at work. If we look at the costs, here we have some interesting effects in the sense that there is, of course, a direct cost that comes from the financing that's needed to implement better technologies. As just been stated, financing is of course fundamental, but we also see that there's in lighter blue an indirect cost that is positive. What happens is that, yes, there is a cost from implementing better technologies, but these investments also boost the economy and therefore compensate for the necessary initial investment costs. There is also an indirect international effect, which is positive, especially for smaller economies. So for Japan and Korea, we see that when China also takes action and when there is wider action in the region, so globally, there is a positive indirect effect because they're less disadvantaged by taking by scaling up action individually. That international effect is not so positive for China because what happens is that with global policy action, there is more of a compression of the economic activity, and so they would export less. But it's a very small effect anyway. So just to close up, there are also effects that we can't model, but that are still important. And so there are welfare improvements when we undertake policy action on air pollution. And these, of course, increase the with wider policy action internationally, because since air pollution is a transboundary issue, there are, of course, benefits also across countries when we reduce air pollution. So with that, I'd like to close and thank you for your attention. And I hope my presentation showed how to provide higher motivation for scaling up policy action on air pollution.
Thank you, Dr. Elisa Lanzi. Very valuable presentation and insights. Now, from OECD, we are moving to the World Health Organization and have some input on the recent publication on air quality in the Asia and the Pacific region. Let me invite Dr. Nasir Hassan, Regional Advisor of the WHO Regional Office for Southeast Asia. Dr. Nasir Hassan, floor is yours.
Thank you, Dr. Mushtaq. Excellency Vice Minister from Korea, RD, colleagues and friends. May I share with you some of the thoughts that I have today? Can I have my presentation? I was in Delhi, New Delhi, India last July. So when I came, it was just a few weeks. After that, then almost the whole Delhi was clouded. I mean, with dark with air pollution. And I said, this is the first time that I saw a huge air pollution issue. But I'm not coming here to talk about New Delhi, but I want to share with you some of the thoughts that I have on air pollution, why it matters to us, especially from the health point of view. Before that, I was in Fiji. I was in the heaven of the earth, Fiji, Pacific. You don't think about air pollution at all. You know, like you were in many parts of the Pacific, you never see any of this pollution. Before Fiji, I was 7 years in Manila. Then you can also imagine in Manila is also a big challenge with a big population, metropolitan, huge number of vehicles. And then prior to that, I was in Cambodia and Laos. So you can see a mix between the developing and, like small island countries. You won't see my name because I don't know why my name was disappeared there. Next, please. Now, there is a debate between what contributes more to health. Is it the gene or the environment? And this is where, because now we are at the peak of NCD. You go to everywhere in the world, whether developed countries to even small island developing state, you are talking about diabetes, you are talking about high blood pressure, you are talking about cancer, you are talking about respiratory, upper respiratory infection. So just hold on before that. Yeah. So, and they were saying that, is it because of the environment or is it because of the gene? And we found out that, yes, the gene will alter. I don't know what happened to our ancestors many hundred years back, whether they have diabetes or high blood pressure and so on and so forth, because the eating habit was different, the environment was different. But nowadays we are talking about everyone, almost everyone is talking about the NCD. It's a big, big issue. So is it the gene again or the environment? And there was a professor, Professor Yung Chung Ho, I think from Seoul National University. He published a book called The Origin of Diseases. And I think this is a must-reading book. He gave a lecture and we were being opened by the fact that he mentioned that, yes, NCD was the subject now. But the situation is that the environment is also changing too fast, in which the gene is not able to cope with the changing environment. Meaning that whatever the environmental issues is affecting the gene in the long term, and probably also with what we see today with the disease that we have. So I want to start with that as a very important perspective, saying that the understanding of disease, the understanding of human physiology and so on and so forth, it's so complex that it has to be related to how we evolve over time and the environment we are changing. And nowadays, we are talking about 25% of our disease is attributable to the environment. At least a quarter. Whether small countries, big countries, is huge percentage of the disease must be related to the environment, especially children, and especially low-income countries. So you're talking about low-income countries also depends. If you live in a rich environment, maybe not as bad as if you are a woman, children living in a poor community, where you have polluted air, very unclean water, and you have also chemicals and very, effects on the food and a few others, nutrition and so on and so forth. So you're talking about huge environmental issues affecting our health. And this is where when I hear your speech, Minister, saying that many years ago, Korea has shown how environmental health works in Korea. How they works that, because they take the upstream, not the downstream. Once you're sick, then it's very tough. So what Korea has done, have shown through the GIF, the Jinkyon and then Incheon and area, is you deal the pollution upstream. You deal with the environment upstream, not in the downstream. And this is my message. So I can share with you plenty of information, but then these are the few things that they were saying that so because the air that we breathe affecting every cycle, that means from the newborn to when you are teenage, when the children, and then you become adults, and then you become old, and then that's it, you leave the world. So again, I need to quote what happened in Korea, because not because of Vice Minister is here and also my friend from SCAP for Korea. There's a huge study in Seoul, in Korea itself, about investigating the impacts or exposure from air pollution from the baby is conceived in the womb to where the baby is born, and then the baby become a small kid and adults as well. So this is a huge cohort study by Yuhua University in Seoul. So they have done huge work, and they found out that these are the big issue here. So are we talking about small issue? No, we are talking about cardiovascular disease, heart attack, stroke, lung cancer, and this is and there is no country in the world, unfortunately, that need WHO new guidelines. So new guidelines is about 5 microgram per meter cube, which is very, 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 very low. So we found out that most of the 99% of cities in the world are exposed to higher than the WHO guidelines. Many years ago, I was in Malaysia. I'm from Malaysia. It's a huge issues about haze or the dust from neighboring countries. This is a transboundary issue from Indonesia, Malaysia, and then Singapore, so south part of Thailand, a bit of Philippines. So we then having the whole country was blanket with smoke, with dust, with PM. That time was PM10. So we gathered a few scientists. They said, let's get together and find out immediate impact. And you will see that very clearly. There's a huge acute relationship between asthma and PM10, between upper respiratory infection and PM10, and many others as well. So my message to you is that don't go for ambitious, long-term data, even acute. Don't go for complicated modeling. Even you interface between PM2.5 and asthma, you will see a good trend to convince your minister, to convince politicians that something is going on in your country. So that's the message that I have here. It's a silent killer. Now, recently, we had a meeting in March. I was shocked. Maybe you know better that air pollution is related to dementia. Okay? So maybe you know better than, I was quite shocked then, probably related to incidence of dementia they did some studies in London, for example. So The far right there is Professor Malarao, who is the chair of the Regional Expert Group on Environment and Health and Climate Change for WHO CRO. She came and she gave a keynote speech and saying that not only cancer, not only stroke, not only heart, but you're talking about dementia. And you're talking about traffic air pollution is adversely affecting fetal growth. That means right from the small conceive of a baby, for example. Then you will see that Professor Balakrishnan from India, Kamponer Balakrishnan from southern part of India, saying that air pollution definitely affect the issues about the inequality. People, women, children, and people living in the very polluted environment are badly affected. And this is where the inequality is the big issue here. So you're talking about affecting socially, economically disadvantaged, ethnic minority residents, and the whole population, about affecting certain portion of the population in a city or in the country. Now, I come from this region where you have 11 countries altogether. You can see as big as India, it's a big country. India itself about, what, 30, 40 countries, and small as Maldives. And you have Thailand, you have Bhutan, you have Nepal, and a few others. These are the region which are facing huge natural disaster as well as population growth, and economic impacts can be tremendous. You will see that, for example, like over the years, we can see that some countries have been huge, probably increasing over time. So this population average PM 2.5 over the years. So 1998 to 2022. So non-country are probably not so much country that having a lower PM 2.5 over the years. Maybe Maldives, so slightly good for Thailand, but then the rest of the countries are not doing well. And you're talking about, for example, in the context of countries, mostly related to biomass burning. So this is the source apportionment. Then traffic is another big issue. And then sea salts, it can be, because there's some countries, because it are still, there's no air pollution, there's no, ambient air pollution issue. Everyone is cooking very, like clean fuel, but then you still have high pollution. It could be related to transboundary then. So this is where it can be politically, economically sensitive, because you're talking about crossing border between one country to another country. But you will see that the traffic and probably biomass is a big portion of the contribution to the environment, to the air. But even in the context of India alone, then you will see that they are not the same throughout. The northern part of India is the most, and this is where I come from. I work in Delhi. This is where the area that has been affected. And not only in Delhi alone, because there are issues about transboundary as well. Now, there's another issue that, forget about the outdoor air pollution or the ambient air pollution. You are talking also dealing with the indoor air pollution, and that can be more serious in many countries, where they are still relying on traditional stove or probably fossil fuel for cooking. And then also issues about indoor air pollution, people working and exposed to various air pollution indoor, working in the indoor air quality is badly affected. Now, you're talking about, in the context of Timor-Leste, for example, that this percentage of rural residents using clean fuel is very, very low. But at the same time, using clean fuel is also very, very low. So meaning that you may be talking about Timor-Leste, Bangladesh, Nepal, but you're not talking about but for India, Indonesia, probably Thailand, you're dealing more with the outdoor or the ambient air pollution. So you will see also that in this circle, or for Timor-Leste, you may not have to focus on the outdoor air pollution. Timor-Leste, you may have to focus on the indoor air pollution. But for Nepal, Bangladesh, India, and Myanmar, you have to look both the outdoor air pollution and also the indoor air pollution from the health point of view. However, for Thailand, Indonesia, you may have to look into the both for outdoor and indoor air pollution itself. So you're looking to some of the cities in India having different contain different perspective of PM 2.5. Even in New Delhi, different times of the year have different perspective. So you will see different peak of the year. So it's not throughout the year that New Delhi is having high PM 2.10, PM 2.5, but certain months of the year. Now, the problem is that air pollution is not the health. It's not within Ministry of Health. Air pollution is related to others. Biomass burning is not health. It is probably Ministry of Energy. Fuel is about Ministry of Transport and few others. So beyond the health sector is the challenge now. And what Seoul probably have shown just now is that this is done by the mayor who bring all the different sectors working closely together. So what we did was, I'm going to probably, Dr. Mushtaq, look at your watch, and I'm probably need to stop somewhere. What we did was in our region, in the Southeast Asia region, we're saying that we want to aim high. We want to see that by 2030, all countries in our region must have established and functional program measures in place to reduce the health impact of air pollution. So in order to do that, they need to know where we are now. And that's what RD said, we have plenty of information. We have plenty of information here. The problem is that where to identify the B, C, D. These are the switches. I call switches. These are the switch that we need to switch on. Without identifying these switches, we are not going to move to where we are aiming for. So in order for us to move there, we need to know where we are now, and we need to know all the switches here. And these are the switches that we discuss. And these are the switches that we see through the video. These are the switches that even small countries like Nepal or even like Sri Lanka may have to look into innovative solutions to identify your switches that work for Sri Lanka and that work for other countries as well. So my last point, I have a few more slides, which I'm not going to share, is that I was here about 2 weeks ago, and I went to one factory in Sri Lanka. This country is a big multinational company that produce and export garments to outside Sri Lanka. With 5,000 workers for that factory, 100% relying on solar energy, not even 10%, 100% relying on solar energy. And this is good, because whatever you do with regard to climate improvement, you're also doing good for the air quality. This is what we call as health co-benefits between the two. Climate change and air pollution must come together. Anything to do with the climate change has to be dealt very closely with the air pollution. Any reduction of air pollution will also reduce climate pollutant. So, yeah, we want to focus on these 4 areas, which I'm not going to elaborate further. These are the switches that we like to bring forward to the countries, which I'm happy to discuss with you. Thank you.
Thank you, Dr. Nasir Hassan, for very elaborative. Now, before going to next session, any quick reaction from audience? You want to? Okay. From youth. That's very important because we want to see, especially Dr. Nasir Hassan's focus. So any mic quickly for 1 minute, then we will close this session.
Hi. Can you hear me? Is it okay? Okay. Thank you for your presentation. I'm Sakura Takahashi from Japan, and also Children and Youth Measure Group. I'd like to ask you a question because the problem with the air pollution is not, it's that the emitters do not suffer from the air pollution because the pollutants flowed to and concentrated on the downstream of airflow. So my question is that in terms of equity, what do you think the policymakers and other stakeholders can do? That only hotspot countries are not harmed from the air pollution.
Okay.
Yes.
So Yeah, so your question is the policymakers can do to bring the equity, especially between the generations, like youth and adults, like who are the producers or consumers, and the affectees, like children, correct?
Yes, and the equity between the intergenerational equity and the geographical equity. Because
and the geographical equity.
Because,
Any policymaker from the hall would like to quickly provide any quick reaction? Okay, then we hold this question for the panel. So at this, we are closing this session. Thank you very much for this session. And now let me invite for the next panel discussion, Ms. Elenita Dano, and she's the Asia Director for ETC Group. So floor is yours.
I would like to request the esteemed member of the panel to please come forward and take your seats so we could start right away. So thank you. Good afternoon, everyone. I hope that you managed to grab some quick lunch, and those who haven't, I hope that these discussions have so far been filling you up if you're getting hungry. And yeah, thank you very much, panelists. So please come. The 6 panelists who are part of the panel. As Dr. Mustak Memon said, I'm Net Danyo from an NGO, a non-government organization based in Canada with a small office in the Philippines, working on new and emerging technologies and the impacts on communities. And for all of us in this room, and for including the 1% or 10% who are not impacted by air pollution, this is an issue for the whole world. For some, it's even a personal issue. Like I grew up as an asthmatic in Manila, where air pollution is really bad, and my world actually changed. Like moving south in Davao City, like it's magic. Like asthma was gone. Like at least probably very, very few attacks. So it's not even that it's not polluted in Davao. It's less polluted, but it really had impact on my health. Now, just to put that in context at the personal level. So let me welcome you to this panel, to this esteemed panel. Let me begin by introducing our honorable panelists, and who will be sharing with us examples of collective and multilateral actions to combat air pollution. So I would like to give a quick introduction of the panelists before I give them the floor. First, we'll have the Principal Officer of the Department of Environment of Vietnam, Mr. Nguyen Trung Thun. I hope that I pronounced your name correctly. Our next panelist is Dr. Tusita Sugatapala, who is a member of the Regulatory Steering Committee to implement the Clean Air 2024 Action Plan of the Ministry of Environment, also a senior lecturer in mechanical engineering at the University of Moratuwa here in Sri Lanka. We're also pleased to welcome our speakers from the 2 women in the panel who happen to be both from civil society. Ms. Dasha Vaja, who is Technical Advisor, Communications and Outreach for the Community Science Center in Vadodara in Gujarat, India. Also, another friend, Dr. Meena Bilgi, who's a core associate of the Women Organizing for Change in Agriculture and Natural Resources Management, or WOCAN. And we have at the other end of the seats, we have our esteemed speakers from international organizations, Mr. Sang Min Nam, who is Director for Environment and Development Division of UNESCAP. And finally, we have Dr. Nakul Chetri from the Integrated Center for International Center for Integrated Mountain Development, or ICIMOD. He's a senior biodiversity specialist there, based in Nepal. So welcome, panelists. So this is a moderated panel, and we'll focus on why collective action are urgently needed to tackle air pollution based on the experiences of entities who are represented in this panel, and what could be done to fast track to achieve clean air in Asia and the Pacific region, emphasizing that the problem is transboundary in nature, and also to boost inclusive actions at the national and regional levels. So we'll also identify challenges of multilateral actions on air pollution, given that plenty of stakeholders are involved in this region, as well as the way forward to overcome these challenges and constraints. So I'd like to address two questions to the first two speakers who are representing the governments of Vietnam and also from Sri Lanka. We know now that both countries have actually adopted and are continuing to update their regulations to address air pollution. I know that Vietnam is in the process of updating your environmental protection law, which was originally adopted in 2014. And Sri Lanka has a clean air action plan for 2024 onwards that will be presented. So I'd like to invite the two gentlemen to actually respond to two pointed questions. How would you describe the trend and current status of air quality in your country? And what national policies and measures have been implemented to improve that? Also, could you kindly explain the challenges that you have encountered in implementing these measures, especially in relation to multilateral actions and financial support? And how do you suggest these changes to be overcome? So I'd like to give the floor to Mr. Nguyen Trung Tuan, and without pressuring you, I'm giving you 3 minutes to speak because we are catching up time. I hope that will not affect the substance of your intervention.
Yeah, thank you, Chair. Hello, good afternoon. It's I'm very happy to be here to share some information about the air quality management in Vietnam. Like you may know that recently we revised the law on environment protection, just put in active last year. Actually, we have the first law on environment protection from 1993. And we have several versions, and the latest version just last year. So in such kind of law, we have many regulations on air quality management. We have regulation on how to make the national action plan for air quality management, action plan in provincial level. And also we have some other regulation related to air quality monitoring, including automatic monitoring of air quality, air emission. Also, we have a circular economy to have to reduce not only waste, solid waste, wastewater, and also for emission. For example, from the air emission from waste treatment, from industry. And we have just 2 years ago, we have a national action plan on air quality management for the period 2021, from 2021 to 25. And now we doing quite many things. And just with the result of air quality management last year, the quality of air in Vietnam, especially in the big city like Hanoi or Ho Chi Minh City, slightly improved. However, we have a lot of things to do. What we face up now is knowledge of people, including of policymakers, especially in the province level. And also, we need the participation of enterprise because Vietnam is a developing country. So we has a priority for economic development, and that's enterprise sector is play a very important role. Actually, we have the participation of enterprise company in transition of the fossil fuel to clean fuel, like natural gas or something like that. And also we have one company, a very big company in Vietnam, they provide the electric car for public transportation, and also they recently export to the United States. And for the provincial level, we have the system for evaluating and rating for environment protection that include of air quality criteria every year. So we have evaluation and then public in the media. So I think this such kind of thing we should have. And another thing is that we lack of resources for air quality management. So we try to connect as much as possible with not only company in Vietnam, but also other international organizations in the world through the some projects, for example, project for air quality management, air quality monitoring, something like that. Yeah, thank you.
Thank you very much, Mr. Nguyen Trung Tuan. That was really very insightful. Dr. Tusita Sugatapal, could you also share how you describe the status, policies, challenges, and solutions
Right,
of the pollution
yeah.
in Sri Lanka?
Thank you very much. Yeah, good afternoon, everybody. Quickly, like when you look at the air quality levels in Sri Lanka, we have seen a gradual deterioration, gradual one, though still we are more or less within our national standards, which are of course lighter than the WHO guidelines. But then during it's a periodic, like some of the months with the wind pattern, we see the WHO guidelines have been, violated through, these. What the gap is basically the measurements. We don't have very good air quality measuring network, but the limited data shows gradual deterioration of air quality, especially in the urban sector, especially PM10, PM2.5, NOx, SOx. Those are the key pollutants we are looking at. We have ambient air quality standards established in line with the WHO guidelines. And also we have emission control standards, one for the mobile one we call vehicle emission testing program, and also the regulations. We have emission regulation also for vehicle importation. So that's more stringent, which are aligned with EU standards. Then we have stain sources emission standards in place, but the implementation is issue again. But then we have covered, of course, almost all the type of pollutants. We start with the key equipments like power plants, boilers, and so on, and also all the processes and pollutants are covered there. But seeing its level of implementation, now it's under revision now. What we have seen there, the gap is basically the lack of data. And also we have seen when we set our standard, we also refer the regional and international standards. And we see a lot of discrepancies there. And we are also not very sure whether these standards are really implemented. So it's in the paper. The real practical viability is an unknown thing. So therefore, we are really struggling to come up with a very maybe appropriate and implementable standards for station sources too. Even our vehicle emission testing program, we have started in 2008, which has not been upgraded. So it was supposed to upgrade by every 5 years, but it didn't happen from 2008. So it's late, like to all very simple program, but cover the whole country. So that's a good thing. So then more recently in the policy level, the government has taken some serious actions. One thing is, so we had this cleaner action plan starting 2000, a long time back. The present version is 2025 clean action plan. So that's the policy document usually the policymakers and other stakeholders follow to set their programs, part as the program. So vehicle emission testing is a part as one, so we implemented it. Then we have recently, a couple of 2 years back, 2021, we published National Environment Action Plan covering all the sectors. Theme 1 is air quality. So Clean Action Plan is now integrated to the National Air Quality and National Environment Action Plan, which is till 2030. So that has given a new kind of a uplift in terms of the policy level. And also we recently developed a clean fuel roadmap, which unfortunately with the COVID and subsequent environmental impact, we could not get the approval from the cabinet to go forward, but the final prepared draft, which validated by the stakeholders are there. Yeah. So then, very recently, Central Environment Authority has published a document on contingency plan for sudden hazardous events. We had a bad experience with some of these, the events we had recently, the hazardous events, how to act on that. So that's a new policy, document prepared by the government. So we are acting not, but again, I repeating, one of the major gaps are the data, then of course the implementation, level of implementation, and monitoring and modeling also we are very weak. So I think we can collaborate with the regional countries to share our experience as well as get support to go forward in that line. Thank you.
Thank you very much, Dr. Sugatapal, for those updates on the efforts of Sri Lanka to update the regulations, also highlighting the importance of implementing policies. So I'd like to give the floor now to the two ladies in the middle of the panel who are both from CSOs. I'd like to have a discussion with the major groups, like the efforts of major groups, particularly in India. And I hope that you could answer the questions considering the interconnectedness of air quality with other environmental issues such as climate change, circular economy, social justice, waste management, not to mention intersectional issues such as women and human rights. What challenges do regional stakeholders face in achieving multilateral cooperation for clean air initiatives? Also, what are some of the co-benefits that we can achieve by combining the efforts on combating air pollution and climate change? And if possible, also please provide your perspective on a scientific and integrated approach that might maximize this co-benefits. So you can decide, Laksha or me.
Am I audible? Yeah. Yeah, good afternoon, everyone. I represent the Community Science Center from India. And my concern for multilateral cooperation is already emphasized by our expert in WHO, but to reiterate that, I feel to improve ambient air quality, the member states must ensure implementation of the existing policies, make new policies that are very stringent in implementation, and take all the stakeholders to task who are polluting, because we always say polluters have to pay, but that should trickle down to the down to the levels. The other thing was to increase and strengthen the regional cooperation. And we know energy production and consumption, which are mostly unregulated, poorly, inefficient fuel use for cooking and domestic purposes, they are all man-made hazards. So in that case, what we need to do is to have policies in place for market-driven policies and demand-driven markets where, for say example, for cooking, we need to have cook stoves which are already efficient. So there is no hassle for people to go, and it should be at a price which everybody could afford. And that way we should have a market-driven policies, which is depending on the demands. The other thing is to facilitate air quality monitoring, open data sharing, and harnessing digital technologies at high levels. But also for industries, what we need to do is, for example, for cooking, we need to have food industries which should be technology intensive, so that emissions are lower, and support investment in quality. And the last but not the least, because that is where I come from, it's communication and outreach. We need to have a massive awareness program, which is not only for awareness to general public, but it should be a mass awareness program where we need to emphasize people, they should demand clean air for themselves. So that is where the crux lies, and we should have policies and programs that will affect the downtrodden people, which are affected directly by the climate change issues and climate change events that are taking place. We discuss them, we don't see that they are properly implemented, but then we should make resolutions to see that all these aspects are taken into account, and accountability will lies on the master state. So to give some best examples, where I come from, we have a cancer hospital which has a steam generation solar concentrating system, and it is the largest one. It is called the Big Dish. at Muni Seva Ashram, which has a cancer hospital. It has 2,000 meals per day. It cooks through the steam generated by the concentrating system, and it takes a load of 1,000 tons of air conditioning system and also sterilizes their equipment. So what I want to emphasize is institutes which use a large amount of energy should turn to renewable energy, and so that the emissions are less. And not only institutes and industries, but the local authorities should also be taken to task, because they don't pay attention to depollute the cities. Because there are everything is in place. You have STP plants, you have common effluent treatment plants, but that should be monitored and they should be taken to task. That's what I have to say. Thank you so much.
Thank you very much, for the very succinct response, and also for citing very good example from Badudara. So I'd like to ask Dr. Mina Bilgi, could you share with us your perspectives on the question?
So I thank you very much for inviting me here. Can you hear me? Okay.
Yes.
I like to share an example from the grassroots on co-benefit of renewable energy with air pollution. In our project on natural resources management and environment, we introduced biogas plants, solar cookers, and of course the solar, for electricity in the household. And we had a very massive biogas program. Where the women, after using the biogas, they said that, the indoor pollution, because they were inhaling so much of smoke, they had to walk 5 to 6 kilometers to collect fuel wood, and sometimes they would collect wood which emitted poisonous gases. So after the biogas plant, they said that the air has become much better in the kitchen, and kitchen looks much cleaner because the fuel would blacken the walls and everything. And from there, they were saving a lot of time. And they mobilized themselves into self-help groups, into federations, into cooperative. And with the saved time and reduced drudgery, they got into, learning best practices, better practices in agriculture and livestock management, because women does a lot of work in agriculture. And they shifted from using chemicals, pesticides, and so on, to organic farming, to precision farming, and then to collective marketing, to collective purchasing, and so reduce the use of transportation also. And we all know that transportation is one of the major factors in air pollution. So we can very clearly from this example, this is just one example I have mentioned. There are many, many such best practices, which needs to be, of course, scaled up. And we see the connection, you can see that the dots are connecting between the sectors, among the sectors, and with the participatory and consultative processes, because these women are now into cooperatives and federations. This very clearly brings on the table that integrated and holistic approach is very necessary. Air pollution is a multidimensional problem, and we need multidisciplinary actions, implementation of the inclusive policy. And at the end, I would like to say, after hearing Daksha and my colleagues here, that I would say we need a global resolution on air pollution, like we have a global resolution on plastic. We need for air pollution, because it is to do with the health of everyone, and we have so much of data, how the health is getting deteriorated. So what kind of generation and youth we are looking for? So I think we need global resolution on air pollution. Thank you so much.
Thank you, Dr. Mina Bilgi, for pointing out especially the multidimensionality, multi-sectoral response needed, and of course, actions at the multilateral level in addressing air pollution. Thank you. So I'd like to move to the last pair, both from international organizations. We've heard from the intervention of Dechen Shering, and also from the minister earlier about examples, referring to examples of regional partnerships on clean air, also the one that pointed out by Dr. Hassan on ASEAN agreement on transboundary haze and all that. So we'd like to hear more coming from the two gentlemen in the panel, the last set, specifically from Mr. Sang-Min Nam from ESCAP first and Mr. Nakul Shetty from ISIMOD. Could you tell us why multinational and collective actions are urgent to improve the air quality in Asia Pacific instead of just individual efforts at the national level or by institutions and by governments? Also, in light of the need for joint responses and multilateral actions on air quality monitoring, collaboration and data standards, and best practices sharing, and of course, financial support to address air quality issues, could you please give examples, suggestions to enhance regional cooperation against air pollution in the coming years? Sir?
Considering time, I will try to make a point. First, I am excited about our member state finally on this regional action program on pollution last year. So we get equal wrap up. So this will be key reference for not only ESCAP but other multilateral agencies here. First, I will highlight this community of issues and policies and practices when it comes to air quality monitoring and air quality standards across countries. So by utilizing, by collaborating, so we can speed up the process of implementation policies and practices. And similarities of practice and action, like especially in sectoral policies, transport sector, energy sector, industrial sector, there's a good similarity for the policies. So how to effectively share the practices to support mutually supported data center cooperation. So this is about original action program. So key this process. And also the presentation highlighted so to environmental cooperation. That should speak the coordination it should speak to our solution problems, but we don't especially starting from sharing. So also other stakeholders to cooperation. So civil society. So expanding stakeholder cooperation. So strengthening science and policy activities. So that's an experience from so far this political trust and science and society translate into policies that can be origination of pollution, actually discover this concept of the origination I will have a few resolutions of others, but I hope this can be different. This can really stress original cooperation. So you can check on them. Thank you.
So, Mr. Sang-Min Nam, thank you for sharing perspectives of ESCAP and also for pointing out the networking. Also, Mr. Nakul Shetty, could you share the perspectives of ISIMOD on these questions?
Yeah, thank you very much. Actually, it's a pleasure to have the presentation of Dr. Nasir earlier. So he was referring Delhi, and the Indo-Gangetic Plain is the base of Indo-Pacific region where all the trouble comes in. And it is quite evident that science have time and again, given that it is moving from Indo-Gangetic Plain to mountains and glaciers. And the glaciers are accelerated because of this black carbon which is bringing other type of impact in terms of accelerating melting and then bringing disasters and having other cascading impacts. So definitely it's a regional, but also it is crossing not only geographical region, but also societal region and interdisciplinary region perspective. In terms of our interventions so far, there are a couple of things that we have already initiated. For example, the Indo-Gangetic Plain is also shared by two countries, which are Pakistan and India, and we have a program called Two Punjab, One Atmosphere, where the understanding of sources of pollution, its impact and cycle are quite common. And to address this issue, there must be some mechanism and understanding. So we are investing in terms of science, in terms of understanding, in terms of cross-learning and other mechanism that is effective. But what we also like to emphasize is air pollution have a different sources, different mechanism and different kind of impacts in different society. It can come from stove, it can come from cars, it can come from different sources, but the one common strategy or means might not be able to address. So this complexity also need to be talked and thought in when we are designing. And as far as our regional interventions are concerned, as it was mentioned earlier in some of the sessions, that we have gone through this process of identifying some of the common challenges of climate change, pollution, biodiversity loss, which are talked about during this session. And then based on those challenges, we have identified what are the common things that we can move forward with. And then the sketch call to action was brought in, and there is a mechanism being planned to address those things at the operational level with something at the regional institutional mechanism. And that mechanism, once we are there, then definitely this air pollution will definitely be a element of or component or thematic topic which we can devise in terms of how to address this pollution at the regional scale and move forward. So with this, I would like to stop here at that point. Thank you.
Thank you so much, sir, for sharing your response to this conference. Now, I would like to thank our panelists for the discussion, and I would like to open the floor now for questions or reflections after hearing our esteemed panelists in this part of the side event. Anyone? Any question? People are willing to ask. Gio from the major group on children.
And also presenting children in youth major group. So we also engaged in last March in the Climate and Clean Air Conference. So we got a very important message regarding the resolution for us to combine and to integrate all the key messages on air pollution and the regional agreement, the regional program on air pollution, and then the recently adopted agreement on addressing air pollution. So I guess one of the doing forward is to have the resolution on air pollution and closely work on so we can integrate the community actions, because addressing air pollution these days we need highly scientific. It's very scientific and very highly technical. And I guess and we believe that for the resolution we highlight the role of community-based actors in addressing air pollution. As mentioned earlier, in the presentation that one of the most severe when it comes to the health impacts is from household pollution, not the outside, not not just in the cities and urban areas, but the high from the HHP or household pollution. Thank you.
Thank you very much, Gio, for emphasizing the point of Dr. Lina Bilgi. And yes, as Mr. Sanginan said, we hope that this proposed resolution will make a difference this time, like incorporating all these very, very important points and insights. Is there any more at the back?
Thank you very much for sharing. I would like to ask opinion from our panelists. Is there any measures that we are dealing with an expansion of mega project and economic-driven development, because that is the real area where they produce the problem, the pollution. Is there any measure that we need also to, in order to address the air pollution, that we have some measure directly dealing with business and mega project?
Is there anyone from the panel who can reply to the question of Rabali, which is actually identifying like the air pollution issues and impacts of mega projects? Like when you say mega projects, do you mean dams? Industry. Okay, industrial.
In Sri Lanka, basically, it's linked to, of course, the economic development pathways. And now, as a country, we have now committed to this carbon neutrality by 2050. So that map has been now in the public domain for the feedback. So we look into that economic development and plan our mega projects or the industrial development, looking at, of course, climate action, but also looking at other benefits. So, for example, the government has declared that no more coal. So it's a very stringent, high impact on the, air pollution also. But it came up with the carbon, action or climate action, but contribute to the air pollution reduction. So yes, I think it's a government plan in the community development, we look into the air pollution as for the climate change as an indicator, in deciding what are the projects to be finalized. Now, of course, in a larger HPL, environment protection license is going to detail for the assessment of air quality impacts and other environmental impacts. So that's embedded there. But of course, we have to balance between economic development and the environment. So that's the challenge we are having. But also that's an area we are always looking to, how to safeguard the environment while having the development. Yeah, thank you.
Thank you for pointing out, Mr. Sukadapa. Dr. Hassan, before I pass it on to you to respond to that, just would like to ask Mr. Duan if he has any reply, because he actually mentioned this, that because of this new interest in Vietnam as the new sources of digital tools, and also this Vietnamese company that actually produces EVs. So is there any particular measures that you are instituting to respond to this demand that you go about?
Yes, thank you very much for your question and comment. As I mentioned that in the new law, we have increased the responsibility of the enterprise. So, for example, when we have received the big projects development, so we consider the environment and economic. So, environment we control by environment impact assessment first. How to apply, and what is the major environment impact when a project is conducted, and then we have advice and then decide invest or not invest such kind of project. So if the project approved to invest, we have some equipment, some tool to control when the project into the operation. For example, in terms of air management, air quality management, we have the two tools. First is the control of air emission from such project. is, for example, we require the project have to monitor automatically the air emission from the project. And then we normally every year we conduct inspection for priority for big project. So to evaluate how they do the environment protection, something like that. And then we have the economic instrument for tax, for example, apply for such kind of big project. Yeah, I hope I provide information.
Thank you, Mr. Chong, for the very informative response. I'd like to, Dr. Hassan is actually raising his hand. And then we have colleague at the back, and then there's more question now. We only have like 2 minutes.
My intervention is very short. Is the fact that I belong to the older generation, in fact, old. I believe the answer to your question is that younger generation has different perspective. I have seen so many chief executive officers, CEO of medium large-scale industries that the mindset is about environmental protection. The company that I mentioned having 100% relying on solar energy, we have young, young technocrat, young entrepreneurs that the mindset is already different. I asked again the company, how many years will you get the return from that 100% reliance on solar energy? He said 8 years. That means that on the 9th year, you can just get free electricity from solar, maybe a little bit of maintenance here and there. Technology, the second one is that technology evolves. Maybe 10 years, 15 years ago, we never believed that the solar energy as big as we see today, the renewable energy. I was professor in university, I said, this was the theory. Now it's no longer theory. You can see that even in small scale industry, or even in household industry, you can still build business on the environment, based on the environmental protection. I think this is where the policy, the government has to create the policy. Without that policy, it's not going to be sustainable. So the government has to provide the infrastructure, the policy infrastructure, the policy dialogue, and so on and so forth, need to be there. If not, then it's going to be short-term rain. Thank you.
Thank you, Dr. Hassan, for summarizing that. I do share that hope that the current and future generation would actually be better than us in treating people and planet. And also, I think the point that we really hope that future technologies would not continue to rely on extractive minerals. Because even if we talk of renewable energy, we are talking of extraction of minerals still, which has environmental and climate proofing. The time is up. I'm really, really sorry. I've been pressured. I'm applying pressure to you. Please apply pressure to me as well. So I would really encourage you to approach the panelists who would like to address the questions. And I'm sure that will really result longer discussions bilaterally. Just to wrap up the panel, aside from thanking the panelists, I'd like to point out some key things that came up. The importance of consultation, government discussions as well on updating plans to keep up with the reality and also the standards. Also implementing policies that are adopted, not just sitting there and gathering dust. And of course, the need to really involve the different sectors, stakeholders, of course, the involvement of enterprises or private sector was emphasized largely in compliance and enforcement and implementation of laws, the very core importance of multidimensional aspects to the problem and also the response and the need for multi-sectoral action at different levels. Also the importance of information, capacity building, science, investment in science, and converting knowledge to policies, and also identifying common challenges and cooperative actions. So this has been a rich, although really, really fast, rapid fire panel. I'd like to welcome a reflection from the floor before we transition back to Dr. Memon. I'd like to invite Mr. Robert Rain, who's acting officer of the U.S. Department of State, Bureau of Oceans and International Environmental and Scientific Affairs, to share his reflection.
Thank you all very much. And thank you for inviting me to give some reflections today. I'm really excited to be here and really honored. And really, I think my job is just to foot stomp what everybody has said today. It's been incredibly impressive. The presentations have been so rich. The discussion has been so inspirational. So I really appreciate being here. I really appreciate being invited. And I just wanted to, I'm going to reiterate some of what people said, but I'm going to try and be really short. And I hope I can read my computer. So as we heard, air pollution is the #1 environmental risk factor for premature death. And it's the #4 overall. 7 million people died prematurely in 2019 from air pollution, 12% of all deaths. Over 90% of the world's population, I heard 92 in one of the presentations today, of the world's population lives in areas of poor air quality. And improving air quality, we heard different views about this today, but improving air quality is really good for the economy. In the United States, we adopted our Clean Air Act in 1970, and between 1970 and 2019, aggregate emissions of common air pollutants dropped 77%, while the U.S. gross domestic product grew 285%. Total private sector jobs increased by 223% during that same period. So really, you can improve air quality. You can implement laws and policies that are going to improve air quality and grow your economy at the same time. I'm very happy that we've been able to share our experience in this region. I'm going to give you a few examples of that, of what we've done in the Asia Pacific region. But first, I'd really like to congratulate ESCAP on their work on the regional. I'm forgetting the name, the Regional Action Program on Air Pollution, RAPAP. It's a great accomplishment and one that will save lives and improve economic productivity in the region. I'm proud that my office in the State Department recently, maybe about 2 weeks ago, finalized a grant with ESCAP to help implement RAPAP. The project's titled Regional Approaches to Reduce Pollution in Transboundary Airsheds. It will use an innovative machine learning technology and existing air quality data to identify common airsheds and then identify necessary actions and policy interventions to mitigate levels of governance to reduce emissions and address sources of pollution. So really excited to be helping with that project. We also have been funding a project that Duke University is leading to establish partnerships with universities and NGOs in nearly every country in South and Central Asia. The universities and NGOs are using data from low-cost centers, satellite imagery, meteorological modeling, and source apportionment to develop plans to manage air quality and reduce air pollution. These are just a few examples in the region. I mean, we're also working with Indonesia to strengthen its national capacity to manage air quality. And we also worked with India on a computer program that assesses data visualization to show policymakers how incremental improvements in air quality leads to health and economic benefits. So we've done a lot in the region. That's just a few examples. I'm going to skip a few because I know we're short on time. We're very proud of this work, and we're convinced that it will help improve air quality, grow economies, and save lives. But really, it's only a drop in the bucket. We really need to do more. The world needs to do more. We need a better framework to increase and improve regional cooperation on air pollution. The United States, therefore, is planning to, as you've heard already, is planning to propose a new air quality resolution at UNEA 6 to establish a global framework for regional cooperation on air pollution. Our idea is to build on and strengthen existing regional cooperation networks like ESCAP's RAPAP and create a global platform for these regional networks to share information and best practices. I'm really having a hard time reading this, sorry. We also want to increase funding for better air quality, especially through, and we also want to incentivize funding for better air quality, especially through development banks. SCEP's regional action plan is a model for regional cooperation. A better infrastructure across existing regional networks will help information flow and can support the implementation of other nascent regional action plans across the world and draw additional resources. We have a concept paper for the resolution and are working on a resolution text. We'd welcome co-sponsors from the Asia Pacific region. So if you're interested in co-sponsoring, please come and find me and we can talk more about it, or you can email me. My email address is wingRD@state.gov. And I hope I'm within time. I hope I didn't take too long. Thank you all very much. And really, again, this has been super inspirational. And I think in answer to your question, regional cooperation is really important for for the situations that you described in your question. So thank you.
Thank you, Robert. And with that, really big thanks to everyone, all of you. But I really want to big thanks to all my colleagues who were involved in the planning, coordination, and implementation, including Jihan, Unyong, Yongran, Leah, Simon, and Maria. So thank you very much. And please now enjoy the cement session. Thank you.